I've been thinking a lot about what I'm going to do once the baby gets here. Because of my history with breast cancer, I'm not able to breastfeed. That's been really hard for me to accept. I always imagined I would have that bonding experience with my baby. Lately, I've been considering the idea of a wet nurse, and I feel really torn about it. I've learned that breast milk can help protect babies from infections and support their immune systems and development, especially in the early months of life. Knowing that makes me want to give my baby those benefits, even if it's not coming directly from me. Also, I know I'm not the only mom in this situation. Some moms struggle with low milk supply, pain, or difficulty getting their baby to latch. Others may be on medications or have medical conditions that make breastfeeding unsafe. Some have to return to work early or had a traumatic birth and need extra support. So I understand why someone might consider a wet nurse or milk donor. I just wonder how I'd feel emotionally having someone else breastfeed my baby. I'm trying to figure out what's best for my baby while also being okay with my own situation. Do you guys know anything about the topic or have any suggestions?
I understand why you are thinking about it, and I know you just want what is best for your baby. But honestly, the whole idea really freaks me out. I would be so uncomfortable with another person breastfeeding my baby. It just feels really personal and like such an important bonding experience between a mom and her child. I feel like it would be hard not to feel sad, jealous, or even upset watching someone else do that. I also would not like the idea of someone else holding my baby all the time and being around so much. If someone is acting as a wet nurse, they're probably going to spend a lot of time with the baby, feeding them, holding them, and calming them down. I think it would be really hard emotionally because it could start to feel like someone else is taking over your role as the mom. I would also be worried about infections being passed through the breast milk. Things like HIV, syphilis, and other illnesses can sometimes be spread that way. And unless someone has been completely tested, you never really know. I would constantly be thinking about whether they are healthy, what medications they take, what they eat, and whether anything could affect the milk. Honestly, I would rather look into donor milk or formula before I would ever consider a wet nurse.
First, I am so sorry about your history with breast cancer. You've been through so much, and I completely understand why the thought of having a wet nurse would make people feel hesitant, sad, or uncomfortable. If it helps, I personally have been a wet nurse for a few moms who were not able to breastfeed their babies for different reasons, and I think if you find someone you trust and you feel comfortable with, wet nursing can be a great option. While it is true that there are some risks, wet nursing allows infants to receive the benefits of breast milk, such as optimal nutrition, immune protection, and disease prevention when the mother cannot breastfeed. Whether by the mother or a wet nurse, breastfeeding promotes bonding, reduces infant stress, and supports emotional regulation. In addition, wet nursing in the past has significantly reduced infant mortality rates and is recognized as a recommended feeding strategy for non-breastfed infants in emergencies because it has saved lives when formula is unsafe or unavailable. Finally, having a wet nurse can help when the biological mother just needs time to recover from surgery, manage postpartum complications, stabilize their mental health, and return to work or care for other children. Again, I hope that helps you make this decision, and if you are still interested, we can talk more about it, and I would also love to be a wet nurse for you.